glad you're joining me to talk about some health-related issues such as the stressors and demands of studying abroad, things to know before you go, your emergency overseas health insurance, and a pre-departure medical checklist. That's a lot to cover, so let's get started. While we understand how excited you are to study abroad, we do want to ensure all of our students are taking the time to prepare themselves to promote their own health and safety while abroad. Now, most of your friends who studied abroad have probably told you it's among the best things they did in their college career. But it's important to remember that study abroad can be stressful at times, as can any situation that's forcing you to adapt and grow. So, we ask that you think about a few things before you depart to set yourself up for success abroad. Consider your destination and what level of support you can rely on there as part of your program, and think about how these factors will impact you physically, mentally, and emotionally. Will you have to walk more throughout your everyday life than you do here on campus, which can be physically demanding? Will this be the longest flight you've ever been on? Will your diet change? Will you mostly be speaking in a second language, which can be really mentally taxing? When thinking through these questions, consider where you're at right now in your physical, mental, and emotional health, and what level of support you might need abroad. Speak with your physician and/or mental health clinician about your study abroad plan and see what advice they might offer that will help you manage while you're abroad. You may have access to on-site counseling services through your host institution, and if not, you can access a mental health provider in your community, which is covered by our insurance provider, CISI. You will also have access to USC's Counseling Services Therapy Assisted Online, or TAL program, which is an interactive web-based program lasting 7 to 9 weeks. The TAL program gives you therapy anytime, anywhere on your mobile device for anxiety, depression, and other common concerns. And lastly, please feel free to share anything you'd like us to know about you that you feel may require some extra support while you're abroad. We can work with our insurance company to line up a physician or mental health clinician for you in your study abroad destination. We've done that many times before, and it's a lot easier to line up those resources in advance than try to scramble when we're in an emergency situation. We call that continuity of care. It's usually easy to do as long as we know in advance that it would be helpful. There are also some terrific resources you can find right here on campus or on your computer. You can get an immunization at the USC Travel Clinic and get a routine physical at the Thompson Student Health Center. With the immunizations, make sure you set up an appointment about 8 weeks prior to departure. The Centers for Disease Control and Prevention also has some great resources. Its website has country-specific recommendations as well as general tips on staying healthy while traveling, how to create a travel first aid kit, things like that. The CDC's Yellow Book also has advice for travelers. As far as your health insurance, USC Study Abroad students are required to have insurance through USC's vendor, Cultural Insurance Services International. This is international emergency medical insurance designed to be used anywhere in the world for emergency medical expenses. Once you've registered with the Study Abroad Office, our office will enroll you in CISI, and once you're enrolled, you will receive your participant ID card by email. When you receive that email, you'll already be enrolled for the insurance, but you'll also receive instructions on how to create an account on mycisi.com. We recommend that you do that, and once you do, you'll be able to email or view your travel insurance documents in case you lose them. You can also pull up your policy brochure if you're curious about what exactly the insurance covers, such as medical expenses, medical evacuation, emergency reunion, and security evacuation. You can also pull up a copy of the claim form in case you need to use the insurance at any point, a list of providers that are available in the community where you'll be studying and traveling. And also that website will link you to a company called AXA, which is USC's medical assistance provider. AXA is available 24/7, so if you ever have any questions about how to utilize your CISI benefits, AXA is there to support you. Finally, I want to draw your attention to this pre-departure medical checklist. As we discussed earlier, please discuss your study abroad plans with your physician and your mental health clinician prior to departure. You should also ask for a prescription, if you're on prescription medication, that allows you to have your medication for the duration of your stay. Make sure you have that medication in the bottle you received it from the pharmacy with appropriate documentation, like a copy of your prescription. You should not dump all of your pills into a plastic bag with no labels. That will not be well received as you go through customs. In the rare case that you are on a prescription medication here in the US and your doctor here is not able to prescribe the medicine for a long enough period that it will last you the duration of your study abroad program, please reach out as soon as possible and let the Study Abroad Office know. We can work with CISI to make sure that you have access to appropriate medication while you're studying abroad. Under no circumstances should you have any prescriptions mailed to you. They will get caught up by customs and will probably reach you months and months later, or maybe when you're back in the U.S. And as we discussed earlier, please feel free to share with your program or with our office anything you'd like us to know that will allow us to better support you while you're studying abroad. You should also review CISI's policies using the links I showed you earlier on mycisi.com. And finally, in the event of an emergency, reach out to your on-site program staff and our office. We can work with CISI, we can contact parents in an emergency situation. Of course, parents always prefer to hear from their child, but since we're usually in a closer time zone, it can be helpful for our office to keep parents in the loop on updates from CISI and AXA. I hope that you feel a bit more informed about and in control of your health while you're abroad. Don't forget to watch the other modules on academics, safety, and navigating culture.